The COVID-19 pandemic has created many challenges in Black and brown communities, but these healthcare leaders say it's also created an opportunity to address the inequities that exist within the medical field.
Black and brown people are not treated equally. Their symptoms are not taken as severe.
People don't trust, and they have fear.
Part of that fear stems back decades to government studies like the Tuskegee experiment, where more than 600 Black sharecroppers were recruited to examine the long-term effects of treating syphilis.
They were really getting more saline and water and not true medical treatment. Even when it was determined that penicillin could actually treat syphilis.
Part of building that trust is getting more Black professionals into the medical field, a gap students here at the University of Louisville are trying to fill. But that's come with its own set of barriers to overcome.
The application process is expensive. Applying to schools is very expensive. There's different fees. So that's a barrier right there.
For many of these Black medical students, it was support in their early years that helped them and is often lacking in Black communities.
And I had mentors along the way who've encouraged me, who saw something in me.
While these students are on their way to making an impact in the future, health officials say it's up to those in the field now to build up that trust, especially when it comes to COVID-19 and concerns about getting the vaccine.
I think we should not stop talking about it. I think every conversation that we have should circle back somehow to COVID. Yeah, you're here for your teeth, but I'm going to talk to you about COVID.
And as the pandemic rages on, they say that dialogue is critical. Drew Gardner, WLKY News.